Ladies and gentlemen, thank you for standing by and welcome to the COVID-19 media briefing. At this time, all participants are in listen-only mode. After the speaker's presentation, there will be a question-and-answer session. To ask a question during the session, you'll need to press star 1 on your telephone. As a reminder, today's program is being recorded. I would now like to introduce your host for today's program, Michael Schomer. Please go ahead, sir.
Thank you for joining us for the COVID-19 media call for July 17th. We'll start today's call with a situation report from Health Commissioner Jan Malcolm. We'll also hear some opening comments from Infectious Disease Director Kris Ehresmann. After those updates, we will open it up for questions from reporters on the line. With that, I'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. I'll be quite brief today. Around the world, we are now above 13.8 million cases and above 590,000 deaths from COVID-19. In the United States, as of this morning, we are above 3.5 million cases and above 138,000 deaths. Here in Minnesota, we are announcing a new total of 45,013 cases in Minnesota. This is up 669 new laboratory-confirmed cases that were reported yesterday that we're reporting today. This is on a stable testing volume of 14,683 tests yesterday. The median age of our cases does continue to tick down steadily. This is the third straight day of case counts that have increased and are in this high 600 range. And now we are seeing some increases in hospitalizations and ICU bed use specifically. We had an increase of 7 persons in the ICU yesterday, not the first time this week that we've seen additional ICU utilization. We had, unfortunately, 7 additional deaths reported yesterday from COVID-19. 4 of these were in Hennepin County, 1 each in Anoka, Dakota, and Lyon counties. This is 2 people in their 90s, 2 in their 80s, 2 in their 70s, and 1 in their 60s. Again, from a laboratory perspective, we've been pretty stable in the last few days around this 14,000 to 15,000 range. The 7-day average testing positivity rate is remaining at this point at 4.7%. This rate has been pretty steady this week, but is an increase of a couple of tenths of a point from a week prior. We were at 4.5% test positivity a week ago. Over this past week, we've seen a total increase in testing of 12.7% and a 10.2% increase in new cases over that same time period. I mentioned on the Monday call that we at MDH and our local public health partners are stepping up enforcement of the requirements of the governor's executive order, particularly in the restaurant and bar operations area. Since Monday, we've heard from concerned Minnesotans who've submitted 120 total complaints about potential violations in the bar and restaurant arena. The most common complaint from citizens has been employees of these establishments not wearing masks, but also we've heard complaints about too many people in the indoor space, not enough space between tables, and several other issues related to lack of social distancing and protection protocols. I just want to emphasize again how very important this is. We're stepping up this enforcement not to play gotcha with restaurants and bars, but because we feel so strongly that following these requirements is so essential to help reduce the spread of COVID-19, to protect both the customers and staff in these establishments, and frankly, to increase our chances of keeping the spread of COVID to a low enough level that we can avoid pretty drastic dial-backs in what establishments are open and how they can operate. And the compliance that we get not only from the facilities but from patrons helps make it more likely that we can continue to enjoy these services at all. And we appreciate that very many operators and establishments are working hard to do the right thing. Taking these precautions in these particular settings and others this summer also makes it more likely that we will be able to have students in classrooms this fall, college students, grade school, high school, all of the work that is going into trying to hit that right balance between being able to return to in-person learning as much as possible while still protecting the health of students and faculty is just going to be made so much more difficult with high degrees of community spread such as we're seeing right now. So again, these prevention activities that we are all such an important part of, and particularly in higher risk environments, it's just critical to continue to be able to hold the progress that we've been able to make in recent months and weeks. I particularly want to thank our environmental health staff at the Minnesota Department of Health and our local public health partners who are doing this enforcement work and helping to communicate and educate these businesses and patrons. And I know, frankly, they sometimes get undeserved heat from people when they bring up these concerns, but this is really important for the ability of Minnesota to give these facilities a chance to stay open and operating at some capacity, as well as to do everything we can to, frankly, try to stem the increases that we are now seeing. And with that, I'll turn it over to Kris Ehresmann for some comments.
Thank you, Commissioner. What I'd like to talk about today is just appropriate use of our testing capacity. As we've mentioned on earlier calls, we're experiencing some challenges with some of the supplies and components necessary to conduct testing as we see more COVID activity occurring nationally. And for that reason, it's all the more important that we focus on testing the populations that we have prioritized from a public health standpoint. We've been hearing that there are many sectors that are requiring a negative test for people to return to certain activities. The Department of Health does not recommend, we actually discourage requiring a negative test to return to work or child care or to attend a camp or to participate in sports. And many organizations and facilities are doing this, and we want to say that is not the recommendation of the Department of Health. A negative test only means that you are negative on that day, and you certainly could be positive the very next day. So if someone is symptomatic, the most important thing for them is to stay out of their activities until at least 10 days after their symptoms have started, and you have to have at least 3 days without symptoms and without a fever. So that's really what's most important. So if you're a sports organization, a child care, a camp, that's really the most important information you need for someone who may have had symptoms. The reason that we're concerned about this is because it really uses up our testing resources, and we want to make sure that those resources are prioritized for the groups that really need them. And that is individuals who are symptomatic or individuals who have had a known COVID exposure but may currently be asymptomatic. So I just wanted to bring that to everyone's attention and to make sure that some of these groups and organizations were aware that is not a recommendation from the health department to require those negative tests, and in fact, we actually would be discouraging that. And so with that, I will turn it back to Mike Schomer.
Thanks, Kris. Operator, I think we're ready to take questions.
Certainly. Ladies and gentlemen, if you have a question at this time, please press star, then 1 on your touch-tone telephone. If your question has been answered and you'd like to remove yourself from the queue, please press the pound key. Our first question comes from the line of Jeremy Olson from the Star Tribune.
Hi, I have 2 questions. I'll just throw them both out. If you could respond to them both, please. First, I wanted you to discuss why Minnesota's rate of cases with unknown community sources has increased 9 percentage points since late June, since June 24th. You can explain why you think that's occurring. Secondly, does that add importance to mask wearing if we don't know where a third of the infections are coming from? Is it kind of underscore the need to wear masks or face coverings? If you could address both of those, please.
Thanks, Jeremy. let me take the second one first, and then I'll ask Kris to speak about what might be driving the community spread. Your second question about just given the increasing percentage of our cases that are community spread of unknown origin, that absolutely does just underscore the importance of the mitigation measures that we've been talking about. Yes, mask wearing is certainly indicated by these data, as is maintenance of social distancing and avoiding close congregation for long periods of time. So we just want to keep reinforcing, as important as mask wearing is, it's not a panacea that allows us to not be mindful of social distancing and avoiding close contacts for extended periods of time. So with that, Kris, would you comment on what might some insights into the data?
Sure. Yes, I mean, this looking at community spread with kind of an unknown source is something that we monitor very closely. It's part of our dial-back measures that we're looking at. And what that would mean is that someone has not had exposure to a known case or to a known outbreak cluster situation. And as we see more people that fall into that category, that suggests that there is, obviously more transmission, and we're certainly seeing that with all of our indicators. And the only thing I'll add to what the commissioner said about mask wearing is, and your comment, Jeremy, about does this data make mask wearing all that much more important? Yes, it absolutely does. And as the commissioner said, we don't want to think that masks mean we don't have to maintain social distancing. But the other element that is so important related to mask wearing is the fact that we know that a significant number of cases may be asymptomatic and may not even know that they have symptoms. So relying on that doesn't necessarily work. And then the second thing is that we do know that cases with symptoms are infectious before their symptoms start. So again, the value of wearing the mask.
But no indication of why you've seen the percentage increase that you have? I mean, the same situation seemed to be existing in mid-June, so why is it increasing in prevalence now?
Oh, I'm sorry. No, we're seeing much, much more activity. We're hearing about people going to events, camps, all kinds of things. And not every situation like that, just because you attended an event, it doesn't necessarily mean that it's not just community spread, because you're not necessarily saying I was exposed to Fred. You're saying I attended an event. So does that help? So we're seeing a lot more activity in which people are, mixing and not following the guidance, and that is resulting in increased spread.
Thank you.
Thank you. Our next question comes from the line of Emily Hammock from CARE 11. Your question, please.
Hey, Kris and Jan. Thanks for taking my question. I'm just asking again, we've talked a couple times about the supply shortages in testing supplies and whether we're starting to see shortages in PPE. Could you just give us an update on what you're seeing in the PPE supply chain? And then also on your dashboard on the data portal, I'm seeing a lot of PPE that says it's past due. What's the concern level on the stuff that you've ordered that isn't in yet?
I think, thanks for the question, Emily. This is Commissioner Malcolm. I think it might be good if we could get somebody from the procurement team, the supply team, on the call early next week, so we can follow up with them on some greater level of detail. It is you're seeing the data correctly. I mean, we have had some instances of supplies that had been ordered that were expected that have not been delivered, and some supplies that have been delivered that didn't meet quality standards. So that is part of what's elevated our concern about that. Again, we do have decent supplies on hand now, but our concern levels about how much more we may need for the rest of the year have increased because of some of these emerging supply chain challenges. But unless I don't imagine that Kris would have any more specific insights on this particular question, but we can make sure we've got a resource on the call early next week so we can probe that further.
Yeah, Jen, I'll just say that Emily, we did look into this and definitely have had testing supplies diverted, and then I did not get information back on the specific PPE. So the commissioner said we can get you that today, but then have someone next week.
So Kris, just to be clear, so you don't have specific information on whether PPE has been diverted at this point. You just know that some of it's past due.
Right, but I do know that laboratory testing supplies have been diverted. And as I said, I didn't hear back from some of the other team members before the call, but we will get that for you.
Thank you. And do you know where that testing supplies went? Was it diverted by the federal government to other states?
Yes, the message was that it was diverted to the emerging hot spots in Texas, California, Florida, those locations.
Thanks, guys. Yep, anything you can get me later would be great.
Thank you. Our next question comes from the line of Bill Werner from Minnesota News Network. Your question, please.
Hi, yes, Commissioner, I'm wondering if you or maybe Kris can elaborate on what you talked about on the complaints against bars and restaurants, and what are you doing in terms of enforcement action? What kind of capacity do you have for enforcement action? Are you anywhere near exceeding that? So just generally how you're addressing the enforcement aspect of it.
Yes, we have kind of reallocated some of our staff from one area of the COVID response to this activity now, just because, as Kris has said on multiple calls, there is a lot of guidance out there about how these establishments can be accomplishing the goals of social distancing and protection from transmission. So making sure that folks are really clear what the executive order entails, what guidance there is, and what it takes to be in compliance, has been sort of a multi-stage effort. The first visit, and so we do, we get complaints from citizens or other indications that there may be an issue. So staff go in and have a conversation, point out to the establishment what the issues are, tell them how they need to correct. Typically, they'll go back the next day or within a couple of days to see if the issues have been addressed, and if they haven't, then the next step is to apprise the facility that they could be subject to a cease and desist order they will be subject to a cease and desist order if they don't come into compliance. And so far, we've had, I would say, pretty good receptivity from the establishments that this is, that there are teeth to the executive order, that it has the force of law and needs to be complied with. So we appreciate that people are taking this seriously when we have these visits.
I'm wondering, Commissioner, if a somewhat related question, if it's not related enough, then I'll relinquish the floor. But you talked about that we need to avoid a situation where we're having to dial back in restaurants or bars at all. Given the numbers that are out there, are you seeing that as a possibility anytime in the near future?
Well, we need to keep our eye on where the risk spots are and what mitigation efforts are available to us and to the governor. And we're just watching with interest what other jurisdictions, what other states and localities are doing, and what impact that has on rates of transmission and so forth. So, I think what we're saying is it would be great if we could avoid really kind of dramatic actions of reclosing establishments altogether, prohibiting any service in those establishments. We'd like to avoid that, but that there may be other ways that we need to have conversations about further restricting capacity and the like. So those are all things under consideration, but the goal certainly would be to avoid just kind of wholesale closure of those activities or prohibition of those activities. But in all candor, I don't think anything can be considered completely off the table with what we're seeing around the country and our own numbers in Minnesota. But that's we clearly would like to explore intermediate measures before that.
Thank you very much, Commissioner.
Thank you. And as a reminder, ladies and gentlemen, if you do have a question at this time, please press star then one. Our next question comes from the line of Catherine Richard from Minnesota Public Radio. Your question, please.
Sure. So just first, I want to clarify something you said earlier, Kris, about people getting tests when they shouldn't. Are you saying employers or camps are requiring them just to show up even if someone hasn't had any symptoms or any indication that they might have COVID? Or are you saying people who are symptomatic and their work is saying you can't come back until you have a negative test? Can you just clarify that? And then I have another question.
Sure. Actually, it's a little bit of both. We have some situations where work wants to have 2 negative tests before someone can return, and we're not recommending a test-based strategy for that. So that's one example. But then there are other situations in which people are being required to have a negative test just to participate. So it's actually both. So thank you for allowing me to clarify.
Sure. Second question is, we're seeing that deaths are remaining relatively low, but that infections are rising. Can you give us a sense of what the public and doctors should expect in the next 2 to 3 weeks based on where things are going?
Yeah, this, as we've discussed many a time, unfortunately, more hospitalizations are a lagging indicator, and deaths even one step more so. Kris, would you care to elaborate on timelines?
Yeah, right. These are things that it takes a while to see the impact. So even as we have been talking about the increases that we're seeing in our younger populations, yes, that means that we're less likely to see some of the indicators that accompany severe outcomes. But as we continue to see additional spread within the community and see a ripple effect, it is extremely likely that we're going to see our hospitalizations, our use of ICU beds increase, and that's just exactly what other states have seen as well. So as the Commissioner said, they're lagging indicators. They're not. They take a while to have their impact be seen in our data, but we fully anticipate that that's what's going to happen. So it's not that we can say, oh, we're seeing a lot of cases in a younger population, we don't have to worry about this. We expect that we will, in the next weeks, see additional cases. And I think, as we talked even about opening up in June, people were asking, well, how many weeks will it take? And we said, well, the earliest we can see things is 21 days, but it takes a while to get that momentum. And I think as you're seeing now, unfortunately, we're starting to see the impact of all of these things, and it will continue on to affect our hospitalizations and deaths ultimately.
And do you just have a timeline in your mind right now of when, you're going to wake up and be like, well, today's the day we're probably going to really start to see the impact of the activities in June?
I haven't marked a date on my calendar, but I can tell you as an example that as we started to see the increase in cases related to, visiting bars and other establishments, we saw it in Mankato, we saw it in the Twin Cities, we thought we'll see it next in St. Cloud, and then in Duluth, and then in Bemidji, and the pattern completely followed. So, I think that in the next weeks, we will start to see our hospitalizations increase, and we could start to see then deaths increase as well. So no date on the calendar, but in the next weeks, don't be surprised if that's what we start to see.
Okay.
Thank you. Our next question is a follow-up from the line of Jeremy Olson from the Star Tribune.
Hi, Commissioner Malcolm. when you first started unveiling these stats, I might have been gone or missed the discussion of them, but a couple times now you've discussed the increasing percentage of tests versus the increased percentage of cases. And it seems like if I was listening and writing down notes correctly, the percentage of tests is growing faster than the percentage of cases. It just made me wonder if there's a cause and effect here. Are we just testing more so we're finding more? I guess I'm wondering if it's a true increase in cases we need to be concerned about, or if we're just finding more cases we might not have otherwise that were mild or asymptomatic.
Thanks, Jeremy. Just needed to find the mute button there. Yes, I think it's just that the test positivity rate, is aimed at really our best measure for looking at the increase or decrease of just overall prevalence in the community. But that we thought it was interesting to just compare, as other states have done, the relationship between the volume of testing and the volume of cases. You want to make sure that the reason that you're not just seeing fewer cases is because you have fewer tests, and vice versa. If you're able to test more and you're still finding that cases are going up less quickly than total test volume, that's just another indicator that makes you feel a little more comfortable with the rate of increase of case growth in the community. So it's just another metric that we're keeping our eyes on, because we've noticed in some other states, kind of that argument that, well, you're testing more, so you're finding more. Well, if you're not testing very much, but you're still finding more, then obviously, you're testing more, but you're not testing as much more as you're finding more cases. That kind of, does not support that argument that the more you test, the more you're going to find. But we do expect there's a positive relationship, but it's just, are they going up at about the same rate, or are you able to test more and still finding, proportionately the same or fewer number of cases? So, Kris, maybe you have a more straightforward explanation than I just gave of that.
No, I think I'll leave it at that.
And my follow-up on testing is, you've had free events in St. James and Medelia, of course, and also the tests following the protests. Is the restriction on resources resulting in, are you going to be able to continue those kinds of free testing events, or are you going to have to shut those down for now?
Yeah, we think it's really important to keep doing community testing. For one thing, we've learned how very, very important it is to have testing that is specifically available to and encouraging particular populations that we believe have been under-tested to come and participate in those events. So we do intend to continue doing that. The supply issues just create an additional challenge, but we think that remains a priority to do, and we will keep. It's our intention to keep doing that in communities that may be seeing even more concerning trends than what we see on average in the state, and again, looking for communities that we believe have just been underrepresented in the testing that has been done so far.
Thank you.
Thank you. Our next question comes from the line of Paul Scott from Forum News Service. Your question, please.
Hi, I was just following up on the 120 complaints since Monday about violations in bars and restaurants. Are you also following up on leads on social media?
Yeah, I think this is Commissioner Malcolm. Yes, I think we certainly look at that, track that, and that's been certainly a source of some of the intelligence that suggests where we want to proactively visit, even if we don't have a formal complaint. So yeah, we have used that input as well.
Do you know of any towns that you can point to where a picture on social media prompted you to look into an establishment?
Yeah, I think that was true in some of some of the first bars that we saw in the Minneapolis area. Kris, I don't know if there are others you'd point out.
Yeah, there certainly, as the commissioner said, there were some social media posts that alerted us to things in the Minneapolis area, but we've also seen social media posts that have been brought to our attention, not only about bars and restaurants, but about events in which large groups of people are gathering together, not social distancing, the whole 9 yards. And so then with that information, then we're looking and tracking at what's going on in those communities in terms of cases and things like that. So we use it in several different ways.
Operator, we have time for one more question.
Certainly. Then our final question is a follow-up from the line of Catherine Richard from Minnesota Public Radio. Your question, please.
Sure. So I just want to go back to the PPE question that Emily raised earlier with respect to what you just mentioned about the coming weeks and more deaths and more hospitalizations. I mean, if supplies are being diverted to other states, what can you do to make sure that they do get here, especially as we prepare for what looks like to be another surge? How are you managing that, and what can the state do to make sure that we're getting that PPE that we need?
Well, that's, again, good questions that we can dig into in more specific detail with Commissioner Roberts-Davis, perhaps, or one of her team early next week. But just, again, we are feeling we've got fairly good transparency into the supplies that the health systems themselves have on hand, as well as what we have in sort of a state reserve capacity, if you will. And so and have various ability to project rates of use at, current use levels, but at increased use levels as well. So we feel like we have a pretty good line of sight into what's going to be needed where at least in the next, month or 2 months or 3 months, but yet the longer term questions of, and that's with what's actually on hand rather than just what's awaiting delivery. But all that being said, I think we are continuing to think about how do we do even more, particularly on the types of equipment that have been shown to be a little more vulnerable at this point to supply chain disruptions, or where there have been quality concerns about some of the orders that have materialized. So again, I'll just, if I may, just kind of defer some of those specifics to a later conversation when we can get the right resources on the phone for you.
Sure. I mean, do you happen to know? Sorry, Kris, go ahead.
This is Kris. I just want to clarify. We confirmed that we have been made aware of diversions related to laboratory supplies, but we did not confirm that there were diversions related to PPE. That was something that we were going to check on. So everything the Commissioner said was absolutely true about how our PPE is being monitored and how we're tracking all those things. But just to be clear, we don't have confirmation for you yet that our personal protective equipment requests have been diverted.
Okay, thank you. I do appreciate that. I was wondering if either of you know off the top of your head which supplies are vulnerable to the supply chain issues that you know of right now, and or are not meeting the standards that the state requires for those supplies.
I believe that not meeting the standards were some of the masks that we received. But again, I think what we can do is get back to you with the details on personal protective equipment in general, since you're interested, and then can comment on that too.
Okay, thank you.
Yeah, I think that just anecdotally, I think I've heard a little bit about gloves reemerging as a shortage item lately, and gowns have been sort of a on and off challenge. But yeah, so we'll if there's any data that we can pull yet today, we'll happily get that out to you. But I think this would be a good conversation, just given all the nuances and the complexities here to address on a call next week. So thanks for the questions.
Yep, thank you.
That's all the time we have for this afternoon. If you had a question we were not able to get to, please feel free to reach out to the MDH Communications office. Have a good day, and we will be back with you again on Monday.
Thank you, ladies and gentlemen, for your participation in today's conference. This does conclude the program. You may now disconnect. Good day. 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 Now disconnect.